What does a functional medicine package look like? Great question for Dr. Charlie Webb on the Functional Forum.
When we package things, I'm going to try to move pretty quick here when we package things, and I'm going to show you a package so it makes sense to you. But if I brought someone in here, every practitioner here right now, if I brought someone off the street and he had 5 minutes to read their history and gave you what their drugs were, their medications, what surgeries they had, how old they were, et cetera, and you had 5 minutes to talk to them, there's not one person here that couldn't determine that's a mild cardiac case, that's a moderate cardiac case, or that's a severe cardiac case. You can do it in 10 minutes. So we can design packages ahead of time that compile all the fundamentals that we want to have in that, whether it's nutrition, certain supplements, certain labs, et cetera, ahead of time, and then we can tweak it for that person. But again, what we're not selling, what orthodontists have figured out pretty well, is when someone comes in and they want beautiful smile, $7,000, $8,000 is reasonable. What's not reasonable is $7,000 for the hardware, and they never sell you the hardware. You're selling someone a life. You're changing their entire life. And sometimes, as Jeff mentioned, again, we have a hard time thinking somehow that's not worth it. Okay, so this is an example of a package. I know you can't see this, so I'm going to blow it up. And this was one of my packages, and you can put this with any kind of disease process, and you can change it, et cetera. I just want to give you an idea. So, case evaluation. Now, on that case evaluation, for this particular program, $1,800. And a lot of times we think that when we sit down with them, that's when the clock starts. Yet if you go to an attorney and you want him to take your case, he's going to ask for a fee up front because he's going to do research. He or she will do research on your case. Spend a lot of time and hours. When you take on a case, you're going to be reviewing labs. You might be calling another physician. You might be doing some research. That's all part of your case valuation that you should be charging for. If you're doing your job right, you should be spending time on what that case evaluation is, right? So then you have office visits, $1,000 in this case. Is there any specific number of visits? No, but they'll get the visits they need in that course of time. Some people are different. Some people that are more compliant, maybe less visits. It's not going to be based on it. It's going to be based on results. Supplementation, nutraceuticals. So whatever those are going to be, I don't know in this case because all I know is it might be a 4-month case. It might be a 6-month case. And we know in this case, this was going to be covering 4 months worth of supplements. The 6 months is the management. So 4 months, we know that $1,000 on the average person that came into my office, that would cover it. It may be different in your case. It may be $800, it may be $1,200. So every time they get a supplement, they don't have to go back and pay for it, right? It's already been done. And then you have diagnostic testing, whatever those tests are. I didn't upcharge for my test. You may have a lot more tests. You may have less than this. Then you have educational tools. I had a book, a binder. There was wellness classes. There was et cetera, et cetera. So you can see here that the only hard costs are supplementation and diagnostic tests. You can see that 70% of that fee down at the end, $6,000, 70% of that fee, that was the knowledge. That's what they invested into for the outcome. You see? Okay, so packaging your services just does not have to be difficult. I know we covered this very, very quickly in our timeline, but hopefully that'll start giving you some insight on how to start putting this together. And you're going to have again more than one, but you can tie them in once you get the person. But put these together ahead of time makes it a lot easier, and it's a lot better for your patients. Thanks for your time, guys.
Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you called Harnessing the Power of Community in Your Practice, and it'll give you a clinical model, practical tools that double as marketing, and strategies to develop a community of your peers. All you have to do is click on the link below.